Hi, have you been to Vanuatu? Vanuatu is located in the South Pacific. 80% of the population lives in rural areas. In 2007 census, Vanuatu has a population of 234,023. The national language of the Republic of Vanuatu is Bislama. The geographically isolated communities have minimal access to basic health and education services. Vanuatu is the third poorest country in the Pacific region. And just like any other countries, Vanuatu is no exception to health inequalities. In a research conducted by Raman, the study examined the degree of inequality in utilization of preventive aspects of maternal and child health in Vanuatu that pose significant barriers to maternal health care access and utilization, and thereby impact maternal mortality. 3,000 households were selected in 120 clusters. After assessing the 3,000 samples, 615 eligible households were used to represent the population. Probability sampling gives the best chance to create a sample that is truly representative of the population and involves lesser degree judgment. Now, to identify clearly the social determinants, let's look at these two models that describe the characteristics of the population. This is Chai, 16 years old, and this is Victoria, 25. They are both locals of Vanuatu. With this comparison, social determinants like economic condition of the country, mother's age, language, maternal education, employment, household wealth index, and area of residence were identified. Now let's look at how these social determinants affect utilization of reproductive health services in Vanuatu. This socio-economic difference between Chai and Vicky indicates that reproductive health services are not reaching all population groups in Vanuatu equally. Now it's time to look at the bigger picture. The rate ratios that are more than 1 indicates that those interventions are used more by rich women than the poorer ones. For example, a rate ratio of 1.67 for delivery assistance by medically trained provider indicates that women in the richest bands of wealth were delivered by skilled providers 67% more than their poorest counterparts. Evidently, the following inequalities were identified: access to antenatal care from medically trained provider, access to delivery assistance by a medically trained provider, access to better and safer health delivery institutions like government hospitals and private health clinics, access to counseling about AIDS or the AIDS virus, access to testing for HIV or AIDS. Utilization of reproductive health services reduces maternal mortality and gives opportunity for delivery of numerous proven interventions to improve the health and survival of the mother and newborn. The social disparities of the subgroup involved are more likely to demonstrate inequality in the reproductive health services utilization and may lead to negative health outcomes. The main strength of the study is that the data came from a large nationally representative survey. The study used data from the 2007 Vanuatu Multiple Indicator Cluster Survey or MICS, conducted by the Ministry of Health Government of Vanuatu, and technical support was provided by the UNICEF. Despite these limitations, the results have delivered significant evidence that could serve as a basis to evaluate and realign the utilization of reproductive health services in Vanuatu. As recommended by the author, a policy review is needed on charging women for reproductive health services and possibly make blanket exemptions in those regions where the poverty levels are at the lowest to increase uptake of interventions caused by demand-side factors. This recommendation is significant as it will reduce maternal and infant mortality rates as well as improve maternal care services among women in Vanuatu. This study shall provide further evidence that wealth inequality is an important risk factor for lower reproductive health service utilization in the Republic of Vanuatu. The reality that wealth inequality affects health outcomes permit the possibility that this study can be applied to other settings in front of inequalities in the utilization of reproductive health services. This is Eunice Cespedes. Thank you for watching.